for me, family is everything. And it really motivated, I think, me to do what I do professionally. Healthcare can be really complicated. And I had the opportunity as a youth to work in a doctor's office and see front and center the patient's, journey, and see how they didn't always know how to advocate for themselves or even to navigate the healthcare system overall. And I think because of that, I really wanted to work in an industry where you could make a difference and help patients receive better care. My role at Astellas Patient Partnerships is to build strong relationships with patient advocacy groups, really focusing on a patient-centered approach and bringing the right stakeholders together to focus on access to care for patients. One of the ways that we really do that is creating authentic platforms for patients to really share their voice. And at Astellas, we can also learn from those insights when they do that, which really helps improve, the patient experience, strives for better outcomes, and also overall improves access to care for patients with innovative solutions. When I found out I was a champion, I was truly humbled by the recognition. But to be honest with you, at the end of the day, it's really the collaborative efforts of the entire team that really makes the difference. Working with our policy and government affairs, our medical and development, our commercial teams, and so many more at Astellas that make a difference in really putting the patient front and center of everything we do. We are committed at Astellas to really support women at midlife by working with a coalition of different stakeholders with like priorities around menopause. From the federal and state policymakers and advocacy groups to key experts, employers, and payers to ensure that women at midlife are recognized and their healthcare needs are being addressed. One way that we do that is by bringing advocacy leaders together with policymakers to build momentum around legislation focused on menopause in relation to things like healthcare professional training, public education campaigns, employer support in the workplace, and research. It's incredibly rewarding for all of us who have been working hard to elevate the need of women to be supported and recognized throughout their menopause journey. We want them to know that we've got your back and you're not in this alone. My name is Liv Gagne and I work for Cures.